Welcome to the Cultivating Health Equity Stories podcast. In this captivating series, we delve into the heart of health equity, sharing stories that illuminate the path toward a fairer, more inclusive healthcare landscape. Our mission is to amplify voices, challenge norms, and inspire change. Here is your host, Dr. Throy Campbell, a research scientist on health equity issues.
I'm going to try to do something here, Dr. McLeod. I'm going to come back to your story. We're going to come back to your story. But at the top of the show, we mentioned that your mother also struggles with the dreaded disease, and you being her primary caretaker. I imagine that you, with your credentials, knowing how to navigate the American healthcare system, and you having experienced the challenges, how did that help you to help your mother? And can you give us a little background, perhaps, to your mother's situation?
My mom's journey has been something else. It's time consuming in the sense that, when you're caring for caregiving is no joke. It is no joke. And sometimes the focus is always on the patient and not so much the caregivers, and rightly so, because they're ill, they're going through their bodies. But the providers, the person who's providing that essential
You are a unique
care.
caregiver because you had your own health challenges.
Exactly. And so, my mom was first diagnosed back in at my graduation, my PhD graduation. She was dealing with some health issues over the years in Jamaica, but the healthcare system in Jamaica is fraught with all sorts of things, right? We can perhaps look at that system another time, but she came for my graduation in May, and she was very, very ill, and struggling with a lot of pain. And I took her to the urgent care just to see what was going on and just to hold over, get some pain meds to remedy the pain until she was, due to return to Jamaica. And when we went to the urgent care, I think they did like a urine test, and they came back and said, you need to go to the emergency room. And the provider was so fearful that I was just going to take her home, that he's like, if you're not going to take her to the emergency room, I am going to call the ambulance. And because I was going to drive, I said, can I drive her? And he's like, if you're not going to, and I had to literally promise that we're going to go right there. And they had called over to the emergency room and let them know that we come in. And once we went in, her diagnosis was quick, real quick. I want to say within an hour and a half of being in the emergency room. It was real quick because whatever that initial test that they did at the urgent care, it showed some unusual signs that was contributing to the severe pain. It was a crippling pain. Couldn't move, couldn't walk. And so by the time we get to the emergency room, they had some knowledge as to why she might be feeling the pain. So they did a couple of scans and the results came back, and then a doctor came in. And at the time, my brothers were still here. I think my sister was still here because they were all here for my graduation. And, the doctor came in and asked, who are all of us, and, and if it's okay to talk in front of us. And I think that for me, in looking back, was perhaps the most precious thing that happened. At first, for the first time, I didn't feel like I was the only one shouldering these critical moments. I don't think my siblings might have recognized how their presence in that moment sort of help
made a difference,
but it did, because it wasn't just me and her hearing this news and I have to process it but still being there for her. It was all of us, and I didn't have to worry about making these calls to inform them as to what was going on. Long story short, they said, it's advanced stage and it had spread to different areas, and they were going to admit her on the ward, the oncology ward, to see if this was in Florida, Miami. They admitted her. I'm just going to chop up this piece so that we can get to present day. They admitted her.
I know it's a lot. I know.
Yeah, she spent 2 months in the hospital, and that particular instance in Miami was my first test at healthcare advocacy, right? For my mom, because once she was here on a visitor's visa at the time, and
She's on a visitor's visa.
right, and she
Right.
had health insurance, but you do know that the health insurance and the dollar, her health insurance would have carried her far away in Jamaica, but here it's different because of the dollar devaluation and all of that stuff. But she was in serious health dilemma at the time. I mean, almost paralyzed with pain. Initially, they did a quick procedure on her back to sort of cut the pain in half. And then, she was slated for chemotherapy and radiation and all of that stuff. But I had one doctor in Miami who was a naturalized citizen like myself and you, right? Meant that he came from somewhere else, gone through the process, and was a person of color. And he decided, I have to give credit where credit is due. Yes, you must uphold the laws and all that there is in the process. But I find it difficult when you become this gatekeeper, this strict gatekeeper for something that you have no business gatekeeping, and especially that you are coming from an immigrant background like all of us here. And I say that just to say I had one particular provider who was very essential to her team in Miami, that he was like, okay, we figure out what is going on. We are not going to treat her. We're going to stabilize her, and we would medevac her back to Jamaica for care. And I'm like, why would you, you're here to provide services. Why would you care about... It
comes down to the dollar sign. It comes down to money.
Money. Why would you want to get in all of this? Your job, you're going to be paid one way or another. One of his exact line, and I will never forget it today, it's like, every country is responsible for their own citizen. She is not a citizen of the United States, and therefore she needs to go back to her country to be cared for. Mind you, we didn't plan for her to come to the US and get sick, right? She came to my graduation.
Well, you were a contributor to this country.
Exactly.
You are her daughter.
Exactly.
So where does that play into the calculation?
Right.
There's some clear biases in the system that's just awful.
Clear biases, but the fact that you are also an immigrant telling me this, right? And, and so he almost made every provision to have her. He had his team reached out to facility in Jamaica where once she could transport off the plane to the hospital there and receive whatever treatment that they can. He was doing everything up to the Friday when he was leaving. And the Saturday, I was in the hospital with my mom, and, the hospitals have these signs about discriminatory practice and they can't discriminate. And one of their point was, we cannot discriminate because of payment. And I read that policy, and I will never forget the Saturday. It was a Saturday. If I go back and look at my journal, I'll tell you the exact date. The social worker came in because they were making all of these provisions to medevac her, and they were doing everything to nicely cover their tracks and all the things to make sure that at the end they're safe. And she walked in and given these instructions, and I said, I do have a copy of your policy, and here is it. I held it up and I said, how are we going to account for this one? Because at this point, this is discrimination. So I feel that you are not rendering treatment and services because you're more concerned about how we're going to pay for this, right? And that's a violation. And so I went down and now I was speaking in no uncertain terms. She understood what was going on, and she's like, well, let's not, this is just a precaution. We're not quite sure. I said, medevacing her out or stabilizing and medevacing her out is not doing due diligence to the pledge that you guys have taken. This is not care. She is unable to make these decisions. She cannot fly on her own. Yes, you will accompany her, but what about me, her daughter, who can't afford to accompany? So I started making all of these pointers, and before she left the room, it was like I knew I was coming. And she left, and within 30 minutes, some director person came in and saying, "Oh, can you just tell me what you're understanding about your mom's health care and care at the moment?" And I said, "What I'm understanding is that you guys are willing to violate and break your own healthcare policy because there's a presumption that we won't be able to pay. And even if that presumption is correct, now is not the time. You must render treatment." And once I said that, she's like, "Who told you that?" I said, "Well, the doctor said every citizen country must," I repeated the whole thing. And that for me was my first encounter with serious advocacy. That happened 3 days after my mom was admitted. My mom ended up spending 46 days after that conversation in the hospital. So to put things in context, if 3 days after she was in there, you were planning to medevac her to go on out, and because I had to say, "Look, you're violating your policy and I am going to hold you to it," and 46 days later, she was still there, it tells you what they were about to do. And I had to fight.
And the importance of
Self-advocacy. And when you don't have it, because not everyone is built like me, not everyone knows how to advocate for themselves, not everyone knows that, yes, you are in a position of power, but I have a voice too, right? And for example, my mom, most Jamaicans, especially the older generation, they just go to the doctor and they'll sit, whatever the doctor says, that's it. No questions, they just take it. So
they don't talk.
Had I not been there for her, the story would have been totally different. So, when she was finally discharged from the hospital, she was, at a point where it was time, right? It wasn't that they were getting rid of her because of all of these things. They did eventually render proper care, the appropriate care, and so forth.
They realized that you were knowledgeable, you were advocating for yourself and your mom, and they realized the risk in letting you leave without caring as they should for your mom. It is clear. It is clear.
The outcome would have been different. And so, so that was Florida. And, there are other little pieces in there, but I recognize how it became a different experience once I laid the situation out and said, "Look, you're in violation. And if I can see it, you best believe an attorney will see it as well. So you make that decision what you want to do."
Of course.
Right. And so we did have a better experience when I moved to New York shortly thereafter, partly because I was finishing grad school, had work, and so forth. By the time I get to New York, I was working with an excellent nurse navigator. I had one in Miami. It was fairly good, but again, some people just do things based off the money. The one I had in New York was very good. She was aware that part of her responsibility is to make sure that the hospital or the system is taken care of, whether financially being compensated or whatever. She understood that, and I respected that of her. But she also recognized that her primary work and allegiance was to the patient more than the hospital that hired her.
To the patient.
And so she made sure that while she was balancing the hat of being on staff at the hospital, patient care was very pivotal.
It was important. All right.
And she moved in that role. She moved in that role. And I have to say, she was a white lady, right? So we're talking about different ethnicity and all of these racial background. So it's important for me to highlight that as well, that she was a white lady, but she recognized that patient care. And so in New York, we struggled a bit with a doctor, but in the end, it was a better team than what we encountered in Miami, just overall. There wasn't any medical gaslighting. There weren't any ridiculous hoops that we had to jump through, because sometimes you just want to focus on the illness, but then there are all of these other factors that really, stress, added stress. This nurse navigator organize things, appointments, the follow-up, even when we have specialist appointment, and referrals. She'll take a big portion of that off my plate, even when it comes to like my mom's immigration status, because even in that moment, I had to think about that because she was here initially on a visitor's visa. And so how to go about extending the visitor's visa to make sure that she's here legally, right? Because I'm not going to be into breaking the law. So to make sure she's here legally, I never knew that you could have extended a visa until this nurse navigator pointed me in that direction and so forth. So she understood the assignment and she really stepped up to the plate. And perhaps that was, with regard to my mom, that was my first encounter of feeling very supported by a medical system, right? Because that's...
Yeah, I was going to say, you've said a lot about patient navigating. You've said a lot about advocating for oneself and the patient, your responsibility, your mom.
Yeah.
And you speak to the challenges of being here as an immigrant. There's so much to talk about, Dr. McLeod. And you've shared so much individual details that's so good for the audience to hear. I don't know how we pull this together in the time we have left. But what other lessons have you learned? What other lessons have you learned?
I think if I, wrapping this up just in general for myself and just for my mom, you have to keep advocating for yourself, whether they listen, whether they're dismissive, whether it's medical gaslighting, you still have to keep at it, right? And I had to learn that the hard way, and it's very exhausting. It is really, truly exhausting. So that's one thing. And the other piece is, regardless of who the provider is before you, whether you can relate on an ethnic, diverse, racial level or not, it shouldn't matter. It really shouldn't. And I would really hope in 20 that providers would really begin to listen to their patients, especially patients of color. And even when the symptoms aren't as glaring as you, give your patients the benefit of the doubt and stop presuming. And I do get it. And I do understand that even, doctors and providers of color, I do get it that you are trained and oriented in a white system, right? White system. I do get it. So your lens and your training and your application is going to be through that white lens. I went to predominantly white institution, and I'm sure you are too. My training is through that lens. I cannot dismiss that I am a woman of color in these spaces. And while my training may orient me to a white space, my identity must show up. And that's being a woman of color, a Black woman in these spaces.
Sure.
So providers who are of color, yes, be conscious that your training is very white, right? But your identity must show up. And so when you are already aware, just by being a person of color, the stereotypes, the struggles that people of color encounter day to day in and out of system, whether it's a medical system, whether it's healthcare or academic, there are struggles. And I find, this is just me, I find that the issues that we folks of color usually have towards any sort of service that we're providing to another person of color is an unintentional dismissal of our own identity in those spaces, because we're just going based off our training. And to me, that's where the disconnect is. I think providers of color especially need to constantly remind themselves of that identity that they bring with that white
Well,
training.
this is sad. This is sad because research suggests that minorities or people in general are more comfortable, especially in healthcare spaces, when their provider has somewhat of a similar background.
Yeah,
Yet,
but
one's
sometimes they don't.
education can cause one, right,
Yeah, but sometimes the providers don't really take that into account. They just like, oh, it's medicine. I'm just doing it as general.
right.
And the reason I say that
They're doing
we
their
have
job.
to
That's why I think it's
right,
sad.
yeah, and we have to constantly show up with that identity and understand that the training is there.
Right.
It's because when the tables are turned, I have seen Black providers or providers of color, to be more, within the times, providers of color fall ill and having to do some serious advocacy for themselves because the same system in which they work now is working against them. And I think part of that is because they've always left their identity, right? They just go, it's a job, it's a training. No, show up in these spaces with the training and your identity. And because when you do that, when you have your patients of color before you, you will think twice before you say, oh, this is a job or I'm just performing. You won't be as dismissive because the white training gives you that dismissive notion. Right. And I would just say to providers in general, whether white or of color, give your patients the benefit of the doubt. They are the lab.
The benefit of the doubt.
Yeah, we are the lab, right? In the sense that when you're going in the lab, you're going to analyze a specimen, whatever it is, you're collecting data to make an informed decision. You don't have my body. You don't know what's going on. So trust me, give me the benefit of the doubt that I know what's going on in my body. The other part I would add to it is support. Patients truly cannot rely on the medical providers to be a part of the support system. Yes, they are in the sense that they provide the expertise to give the diagnosis and the treatment. So that's one layer of support, but making sure that you have a support system. Like I support my mom, I'm there for her. And I think because I'm there, her journey has been more pleasant. She's able to go through her treatment. I've seen the impact of having support. Because when she's in Jamaica and she doesn't have the support, her health decline drastically. When she's here and I'm caring for her, it's like night and day. So the support is needed, and support is not always financially. A phone call, even showing up at an appointment, I would recommend not going to any appointments by yourself. Try and get someone to go with you. I went to mine on my own, and I can tell you, as strong as I am, it was hard. It was difficult, right?
It was
Especially when you have a provider who is challenging to deal with and emotions are running high, right? And so it was hard. But I also know that when I show up with my mom to her appointments, it is easy, right? She can listen. I can take notes. I can ask questions. She can ask the question and all that. So support, and that piece is something that is needed. The support in general, even just going back to, I know we're probably running out of time. I didn't even get to talk about how I had a severe side effect in my first day of
a severe side effect during treatment, right?
A near-death experience in treatment that my provider completely dismissed. And again, I had
wasn't listening.
Wasn't listening. And I had to really, advocate for myself there and then. And again, if I had the support, someone just to say, or just to be there, even if
for
you have
you.
nothing to say. And so just in general, those are some of the advice, that I would provide.
You've given good advice, and which we appreciate. You've given good advice. And perhaps Dr. McLeod, we can come back for a second interview.
I think the work that you're doing here is important and wonderful.
It's important
because health is a system in of itself, especially here and I guess anywhere you go, it's a system, and systems are oftentimes designed to favor some over the other. There is truly equity can be achieved, but because the system was inherently designed to disenfranchise, right? And do all of these things, that we find equity to be a challenge to achieve. And so to hear stories like this and to disseminate it and get it out there is an attempt to sort of dismantle the system and begin to lead with equity. And I think this is a wonderful thing that you are doing.
I didn't want to finish the conversation without asking, how are you doing today and your mom? How are you both doing? I know the audience would like to know that.
We're doing good. I am fairly stable. I had a recent follow-up, I think late last year, and things were looking pretty good. I'm not in active treatment or anything, and I haven't been for a while. At my last visit, I was moved out to like 6 months. So, when you have gone through chemotherapy and cancer,
that's a good indication.
You have different visits. So I'm up to every 6 months now to see my oncologist. My mom is still in active treatment. She's been, it's over 10 years now, but she's been in active treatment, but very stable. She does treatment monthly, not monthly. Well, it's kind of a design where she sees her oncologist monthly, but do have, I think, 2 weeks on, 2 weeks off chemo on a regular. So that's her schedule at the moment. And things are fairly stable with her.
I wish we had the time to talk. Yeah, I wish we had the time. And that's why I think we're going to have to come back, because there's a cost to that. And there's a way, and the challenges in navigating all of that with long-term care for your mom, But we appreciate what you've shared. And there's a lot that we can take from what you've shared with us today.
And I guess the last closing props, as you mentioned, that finance is there, but you still can't just make a decision on that. But perhaps most importantly, I want to close out on, because being a patient myself, but also a caregiver, that is very hard. And so for those who are going through their journey and having a loved one or someone in your corner actively and physically caring for you, they deserve some love and appreciation. It is hard because caregiving doesn't come down to just providing basic needs and being at home, attending to appointment. It is a lot. At least I know it's a lot on my plate. And sometimes
a caregiver needs a caregiver. It's difficult.
And sometimes, because your life change, right? A caregiver's life, once you take on that role, your life change. The life that you were living at that moment is no longer. It's a sacrifice. You've put those needs and wants on the back end to rise to the occasion to meet this person's needs and wants. And it is a sacrifice.
We admire the sacrifice you've been making on behalf of your mom. And this is a very unique path that you've taken. You being a cancer survivor and your mom still on the path. And we just admire your advocacy and your strength and your resilience. And you've done a lot today by sharing all this important information. We wish you and your mom good health, and keep on doing. Just do it. Thank you.
Thank you for having me. It was a wonderful experience.
Thanks for listening to Cultivating Health Equity Stories. Remember, our mission is to amplify voices, challenge norms, and inspire change. Go to cultivatehealthequity.com, sign up on our email list, subscribe for future episodes, and find the resources mentioned in the show notes. Until next time.